I'm Susan. I'm a wife. I'm a mother. My husband Jamie and I have been married. We celebrated 30 years last year. I have 2 grown children, Nicole and Logan. Nicole and I, we love to host. We love to have our friends over. We will cook and make things for them, and they mean the world to me. My friends are my support system. They are always there for me through good times, through bad times. My friends are like my family. There's like nothing I wouldn't do for them. When Mimi found out that she needed a kidney donor, we all wanted to be tested. And so we went through the testing to see if we'd be a match. And I scheduled my mammogram to get started. I remember so vividly, Mimi, when we were just talking about it and getting tested, and I do remember that, just thinking that I just had that feeling, that there was gonna be something that you're gonna save my life and me trying to save your life. I was diagnosed with HR positive, HER2 negative, node positive, early breast cancer. After my diagnosis, it seemed like things moved fast. We scheduled a breast MRI and they found that there were 4 suspicious masses. So then it became from a simple lumpectomy to my doctor and I discussed that double mastectomy was gonna be the next steps. During active treatment, it was hard. I felt like at times things were out of control, and I'm somebody that likes to have a plan. I felt like after my surgery and after my active treatment, in my mind I was like, what's next? Is there a next step? Is it all done? And I had to worry about, the cancer coming back, reoccurring. And so when my doctor told me about Verzenio and hormone therapy and the possibility of reducing the risk, it made me feel calm. It made me feel confident in the next steps. Taking Verzenio gave me confidence because I was taking something specifically for my type of cancer. And that made me feel even more confident that I was doing the right thing. I was doing all that I can do. I felt like my doctor was very good at setting expectations. She was very good at preparing me to help manage the side effects. During my treatment with Verzenio, my oncologist encouraged me to try to do what I normally would do. When my son, it was his senior year, and he's on the football team. We went to every one of his games, whether they were home or away. So these were long days, and I was concerned at first I wasn't gonna be able to do that. And my doctor did. That was one thing that she encouraged. I do like to travel, and I was worried, is that something that was gonna change now through this treatment? And I was able to get on a plane, and I was able to still travel long distances. My friends, we love to go on a girls' trip, and that's been something we just look forward to every year.
Down to the beach. Oh, that was a great picture.
That was like sunset.
I'm so glad that we went last year. I was very hesitant after surgery and thinking that I should just stay home and I should skip the trip this year. And I was so glad you guys talked me into it. It's exactly what I needed. Having my friends that I've been friends with for so long, that we've been through so much together, be a part of my journey, just meant so much to me. And I want to do more things and see more places and be around for my children. And I know that I'm doing all I can do.
Verzenio is used to treat certain types of breast cancer known as HR positive, HER2 negative, hormone receptor positive, human epidermal growth factor receptor 2 negative breast cancer. It is a medicine you can take if you have node positive early breast cancer that has a high risk of coming back as determined by your healthcare provider. Verzenio is given along with hormonal therapy to women and men. It is not known if Verzenio is safe and effective in children. Warnings. Verzenio may cause serious side effects, including diarrhea, is common with Verzenio, may sometimes be severe, and may cause dehydration or infection. The most common time to develop diarrhea is during the first month of Verzenio treatment. If you develop diarrhea during treatment with Verzenio, your healthcare provider may tell you to temporarily stop taking it, stop your treatment, or decrease your dose. If you have any loose stools, start taking an anti-diarrheal medicine, such as loperamide, drink more fluids, and tell your healthcare provider right away. Low white blood cell counts, neutropenia, are common with Verzenio and may cause serious infections that can lead to death. Your healthcare provider should check your white blood cell counts before and during treatment. If you develop low white blood cell counts during treatment with Verzenio, your healthcare provider may tell you to temporarily stop taking it, decrease your dose, or wait before starting your next month of treatment. Tell your healthcare provider right away if you have signs and symptoms of low white blood cell counts or infections, such as fever and chills. Verzenio may cause severe or life-threatening inflammation, swelling, of the lungs during treatment that can lead to death. If you develop lung problems during treatment with Verzenio, your healthcare provider may tell you to temporarily stop taking it, decrease your dose, or stop your treatment. Tell your healthcare provider right away if you have any new or worsening symptoms, including trouble breathing or shortness of breath, cough with or without mucus, chest pain. Verzenio can cause serious liver problems. Your healthcare provider should do blood tests to check your liver before and during treatment. If you develop liver problems during treatment with Verzenio, your healthcare provider may reduce your dose or stop your treatment. Tell your healthcare provider right away if you have any of the following signs or symptoms of liver problems: feeling very tired, loss of appetite, pain on the upper right side of your stomach area, abdomen, bleeding or bruising more easily than normal. Verzenio may cause blood clots in your veins or in the arteries of your lungs. Verzenio may cause serious blood clots that have led to death. If you develop blood clots during treatment with Verzenio, your healthcare provider may tell you to temporarily stop taking it. Tell your healthcare provider right away if you have any of the following signs and symptoms of a blood clot: pain or swelling in your arms or legs, fast breathing, shortness of breath, fast heart rate, chest pain. Verzenio can harm your unborn baby. Use effective birth control contraception during treatment and for 3 weeks after the last dose of Verzenio. And do not breastfeed during treatment with Verzenio and for at least 3 weeks after your last dose. Verzenio may affect the ability of males to father a child. Common side effects. The most common side effects of Verzenio include nausea, abdominal pain, infections, low red blood cell counts, anemia, decreased appetite, headache, hair thinning or hair loss, alopecia, tiredness, low white blood cell counts, leukopenia, vomiting, low platelet counts, thrombocytopenia. These are not all the possible side effects of Verzenio. Tell your healthcare provider if you have any side effects. You can report side effects at 1-800-FDA-1088 or www.fda.gov/medwatch. Before you use Verzenio, tell your healthcare provider about all your medical conditions, including if you have a fever, chills, or other signs of infection, if you have a history of blood clots in your veins, have lung or breathing problems, have liver or kidney problems, if you are pregnant, plan to become pregnant, or are breastfeeding, about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Especially tell your healthcare provider if you take a medicine that contains ketoconazole. How to take. Take Verzenio exactly as your healthcare provider tells you. Your healthcare provider may change your dose if needed. Do not stop taking Verzenio or change the dose without talking to your healthcare provider. Verzenio may be taken with or without food. Swallow Verzenio tablets whole. Do not chew, crush, or split the tablets before swallowing. Do not take Verzenio tablets if they are broken, cracked, or damaged. Take your doses of Verzenio at about the same time every day. If you vomit or miss a dose of Verzenio, take your next dose at your regular time. Do not take 2 doses at the same time to make up for the missed dose. What to avoid during treatment. Avoid taking ketoconazole during treatment with Verzenio. Tell your healthcare provider if you take a medicine that contains ketoconazole. Avoid grapefruit and products that contain grapefruit during treatment with Verzenio. Grapefruit may increase the amount of Verzenio in your blood. Learn more. Verzenio is a prescription medicine. For more information, call 1-800-545-5979 or go to www.verzenio.com. This summary provides basic information about Verzenio, but does not include all information known about this medicine. Read the information that comes with your prescription each time your prescription is filled. This information does not take the place of talking with your healthcare provider. Be sure to talk to your healthcare provider about Verzenio and how to take it. Your healthcare provider is the best person to help you decide if Verzenio is right for you.